The Acumed Locking Clavicle Plate System is an extensive collection of 31 plates designed to treat comminuted fractures, malunions, and non-unions. This includes a range of 16 low and narrow profile plates that specifically address the superior midshaft portion of the clavicle. Please refer to the product brochure for a complete description of the surgical technique and range of options available for radiographic evaluation. After completion of a thorough radiographic evaluation, the patient is placed in a beach chair position with the head rotated and tilted 5 degrees to 10 degrees away from the operative side. A bolster is placed between the shoulder blades and head, allowing the injured shoulder girdle to retract posteriorly. This will facilitate reduction by bringing the clavicle anterior to restore length and improve exposure. Surgeons may choose one of 2 incisions. Option 1, a 3 cm to 5 cm transverse infraclavicular incision, is made parallel to the long axis of the clavicle so that the scar does not lie over the plate. This approach provides convenient, unlimited access to the entire length of the bone. Option 2, an incision along the Langer's line, running perpendicular to the long axis, provides better cosmetic results and less damage to the supraclavicular cutaneous nerves. Attention is made to protect the cutaneous nerve branches as they cross over the operative field, although this may not always be possible. It is also important to keep soft tissue attachments to the butterfly fragments in an attempt to maintain vascularity. The fracture is cleared of hematoma and debris and anatomically reduced. Reduce the fracture by placing 2 reduction forceps on the medial and distal fragments. Distract, elevate, and rotate the distal fragment to obtain reduction. Once the appropriately sized left or right midshaft clavicle plate is selected, place the 2 middle compression slots over the fracture, ideally leaving 3 locking and/or non-locking holes, both medial and distal, to the fracture fragments. Usually, the larger plates are ideal for most males, medium plates for smaller males and most females, and the narrow profile plates for the smallest patients. In a fracture with marked comminution, the plate is used as a template to bring the clavicle out to length. Bringing the clavicle out to length decreases tension on the fixation and helps restore the normal function of the scapula and clavicle as they work in a unit with shoulder flexion. In fractures of the middle medial third, the plate is utilized as marked, medial and laterally. In fractures that involve the